kind of want to ask a little more advanced question now. And I think if we can bring the shoulder in just a little bit, because I feel like it's a tougher one. There's so many influences on the shoulder. And if we think about this, I've spent many hours thinking about this discrepancy between something like CARs, controlled articular rotations, of trying to increase a joint's ability, so to speak, and position. This is more of the DNS PRI guys talking about the importance of position. Like, I always remember those guys say, like, and unless that neck is somewhere neutral, don't touch that neck, right? We know this line. And like with the shoulder, for like question number one would be, do you have a parallel to the shoulder like you do for the hip? You have the hip extension against the wall. Do you have a sagittal go-to for the shoulder? And then the second question is more that advanced question of shoulders get stuck in positions, man, like either just pec minors that have been holding a shoulder blade in a position for a decade, and the discrepancy side to side of a shoulder blade or a glenohumeral joint can be just intense in my experience, side to side. I mean, so do you still attack it basically? And then, like, let's say my worry is you go after something like shoulder flexion, but they're in such a poor position that you either can't get out of that position no matter how much flexion you're working on, or you create a secondary issue of laxity or something in a position that's not even good. Do you know what I mean?
Yeah, what's weird is I think shoulder is the most complex, and yet at the same time the most simple to sometimes attack if it's not a high level athlete. A lot of the same things apply like it does in the hip for general populations. They need very particular ranges of motion. I have a few exercises that I always do with shoulders too, that in my mind are the clinical equivalent to a wall stretch for a shoulder, right? Because in my mind, when you're talking about a shoulder, you're really talking ribs. And this gets into much more of that deep conversation of, this is why shoulders really are complex, because ribs are weird, man. And you get into that deep dive is not something I encourage new practitioners to get into unless they have someone either guiding them or they have something to like fall back on for treatment, because you start getting into weird stuff. And in a lot of times patients, you'll lose them because you're trying all these weird different things. I use a lot of gymnastic style for my, shoulder behind the back, just having a broomstick and being able to get into that. Is it shoulder? No, I'm blanking out right now. It's
extension.
Shoulder extension. Yeah. I'm like,
like stall bar stuff. I know you're a big fan of the stall bars.
Yeah. I wish that everybody had a stall bar because it just makes life easier, but I just want a lot of shoulder extension, and I want to know that you can, bring both arms pretty close together behind your back and then start to differentiate the scapula and the humerus away from the rib cage, and just being able to separate those so that they're not articulating together. What we talked about before, differentiation of those kind of things. And then I use a very something I stole from a pitching coach, I think it was years ago, but in the transverse plane, being able to put the body into a quadruped position and then being able to have them slowly go up against a wall so that so that they are rotating against a pelvis that is fixed. So then I know where your problem is coming from. Do you really have, and everybody has it, do you really have just an upper quadrant problem, or do you have an upper quadrant problem with a lower quadrant compensation? Well, you just need to treat both of them almost at the exact same time, because that rib cage is the pelvis, right? Like it's having all of that force moving through it. Those are, I don't know if that's I don't know if I answered your question or just talked in a circle.
No, it was good. And the secondary question was a little bit more about that worry about position. But I also have a follow-up, which would be, why do I care about getting shoulder extension in a patient that has a problem with flexion? Just want you to answer that one. Like, why do you go after extension when the problem is, it hurts when I do pull-ups, hurts when I do overhead squat at CrossFit? It's all flexion problems.
Yeah, I don't know if I can articulate
up a level.
Well, it is. It's true. It's like, it's almost the same as, in the hip. Like, why do you get hip extension first? Well, it's like, besides being one tissue in the front that you may be impinging on as you go into flexion and through there. And you're just, to me, in my mind, and I don't even know if I actually quite understand what I don't know if I actually have the answer to your question, but as I'm thinking through it and talking, you know, I'm trying to free the joint up in multiple ranges of motion so that I can increase the variability. Because it sounds like if you're only getting pain in one range of motion, then that's the one that you're limited in, and you have no other variability to go anywhere else, right? So there's a lot of tissues and a lot of structures in the front of your rib cage that you want to loosen up in extension, so that as you go through flexion, those things can clear so that the shoulder can get into a better position. And then also you're just trying to get the ribs to be able to move.
And yeah, that's good. Yes, it's
ding,
good,
ding,
man. I'm assuming you want that rib cage down when they go into hip extension, or sorry, shoulder extension.
Correct. And I want the subclavius and all of the pecs to be able to inhibit, to allow the ribs to come down, because if they're just coming up with the shoulder, then everything is moving together. So I want to make sure that those things are cleared so that I can go into those other positions and the humerus can articulate on a scapula that's on a better plane of motion on the back of the ribs, right? Because everything's happening at once. And so I guess maybe in my mind as a new doctor to explain it, clear out everything as long as you're not creating a pathology or a hyperlaxity somewhere.
I think that for when I think about what, I'm going to translate some, Steve, because that's one of my few things in life that I can do.
We've known each other for a very long time, and half of the stuff that comes out of my mouth, I don't even understand. So if you could translate, that'd be great.
I invited 10 people to my wedding, and my wife invited 10 people. Steve and his wife are one of the 10 people I invited to my wedding. So I can translate. What we were talking about in the very beginning, you asked him, we were talking about getting the ribs in a good place so you don't get the humerus to torque into a weird position. You don't rip a ligament. You don't rip one of those specific rotator cuff. So if you get the base right first, and that's kind of what he's talking about, getting those ribs back. In terms of extension, one of the first things in terms of PRI is getting those ribs down and back. And it's very hard for people to isolate, and this is why it gets technical for new doctors, to by themselves, don't move anything and just pull your ribs down and back. That is not no, it's really hard to have that awareness unless you're like a dancer or some kind of gymnast or Cirque du Soleil. You don't have that differentiation between your prime movers and, like, say, your torso. So with like a shoulder extension, like the broomstick, or I posted an exercise that was a core one where I put my arms way back and I was lifting my feet up. Putting the arms back into extension will pull those ribs down and back. And you'll also get some of that opening up of the soft tissue in the front. But if you can kind of hold your arms back there, you'll see patients start to freak out. The stall bar too, they can't really breathe with their arms back there. Same thing goes with what you were talking about, the guy with the hip flexor. He would cry and he couldn't breathe. Like that whole thing. Can your body chill out there? So sometimes going into humeral, your arms extending, will also then flex those ribs down in a natural way to set that base. Because so with the arms going overhead, the flexion problem, those ribs are also now in an extended problem, right? They're overextended. You see the rib flares up too much. And so technically we want to start to get those ribs to flex down and get a better base so that the arm can go flex up on its own. And I think arm extension pulls those ribs down into that flexed position more comfortably and easily. Then there are fun rib techniques to do, but sometimes it's the same thing as just put that arm back and try to breathe there for a little while.
All right, now I want to hear Bobby's. This is all three of us saying the same thing in a totally different way.
Yes, exactly.
Well,
What's your answer, Bobby?
I have a comment on it, which is it was very counterintuitive for me, this idea initially of rib IR or ribs going down having something to do with my ability to go overhead with an arm, because it seems way more intuitive that ribs go up as scapulas go up, as humeruses go up, right? But I noticed, I'd worked with some high-level CrossFitters, ones that get paid good money, and you see these x-rays of zero, kyphosis in the thorax and actually a reversed cervical curve and maybe a high amount of tension or headache issues associated with their ability to do their sport. And I would say those are usually one of the best ones, but they usually don't win. They're like very, very good. They work really hard, but they need a lot of work just to calm down. It seems like they have so much tension. These are more adapted to the full extension. Everything is extended. Everything is ER'd. Everything is, those ribs go up as the head goes forward, as the shoulder blade. So they've built this ability to do amazing things like one-armed heavy overhead walking lunges like you have to do in the last day of the CrossFit Games. But I'm worried more about those people 10 years after they're done with CrossFit. And now they're getting kind of stuck in these positions, and you can see a lot of pathology associated over time to things like labral tears or rotator cuff tears. And when we test them on the table, things that we know, they can't go ribs down with, especially without a whole bunch of stuff moving. As you push those ribs down, all the head looks up like 60 degrees as you push their ribs down. This is just what I was thinking as I'm listening to you guys explain. But it was very counterintuitive for me to this idea of getting, posterior expansion, which would increase the ability to have a good shoulder.
It is weird. And I find the same thing. When you start working with really high level people, I think it's very interesting to see either how the naturals are natural. Like when you see somebody that doesn't have any problems and then you do tests with them and they're like, man, they have all these ranges of motion. No wonder they don't need to come and see me. And no wonder they have 10 years in the league, when you start seeing professional athletes. And then you see this other person who works really hard, but man, they are fighting everything. And and I've had some discussions with parents and I go, no, your son is not going to be, maybe he will be, maybe he'll, maybe I'm reading this wrong, but he's going to be fighting his genetics or his natural ability his whole life to try to compete at this high level, because his system is 15 degrees off of center, and to try to get it back to that zero neutral place is really hard. And that's going to eventually wear it down like he's running at full octane. And these other guys, I think my expression is always like, they just wake up in the morning and they take a poop, wipe their butt, and they just go kill it because they're just genetically amazing. And you just think, wow, man, like that's impressive, especially at the CrossFit Games, when you really see that the level of the top 5 is actually so much more astounding than the rest. They're just freaks.
Yeah. I was trying to think of, I totally lost my train of thought, but I wanted to keep going with the CrossFit guys. Like this idea of, like you said, they better win the games before they break, some of them, right? Like hopefully they can do it before things break. And you got the people like Froning and now Fraser and people like Tia Toomey, you put them on the table and they just you guarantee they can just put stuff down, lift, arms go up, ribs go in, they could twist, they could turn. And it's always, when I've worked with CrossFitters, especially, I bring up those people on purpose to say, it's their efficiency. They hardly get any serious injuries. That's why you can win year after year after year. And they can just it's like Froning climbing back at the end of every WOD, just catches everybody because he never breaks down. And those are those lucky people. You put them on the table and the stuff just moves wonderfully. And if something freakish happens, they recover really fast. They're the ones back after 4 months on an ACL tear.
And I think, again, for these new doctors, that is such a small population of human beings on this earth, let alone people that are going to come into your clinic. This goes back to the beginning. Keep it simple, stupid. Like, your Tia Toomeys are not accidentally, the Matt Frasers are not just going to wind up in your clinic. You know what I mean? Yep. Like, the vast majority of people, you don't have to overthink it and get really technical with. You can go back to this earlier stuff.
Even if they're super high level, it's amazing to me to watch how many so incredibly gifted athletes suck at so much stuff that's very basic. And I go, yep, you're going to be rocking for only a little bit longer though, if you don't make this better, because over time you running red line is not going to work out. And you see those people, like you said, Rich Froning and them, like CrossFit is that most amazing sport that just puts you to it's the volume that you go through that really test the neuro system and its ability to wind back down and breathe in a weird, uncomfortable position, like you were talking about, John, and those things. And it's amazing, even the CrossFitters that I work with that are just like, they get excited about CrossFit and how much better that they get with a little bit of mobility, just a little bit.